Good day, I am Rica Guevara, and for today I will be assessing the abdomen of my patient. For this assessment, we will be needing a gloves and a stethoscope. First I will be introduce myself to my patient and verify his identity. So, good day sir, I am Rica Guevara, your student nurse for today. And may I know what is your name?
I am Justin Dipsing Isekon.
Okay, and when is your birthday?
February 5, 2009.
Okay. So for today, I will be assessing your abdomen. So ang gagawin po natin is ipapalpate or ipapercast ko po yung tiyan nyo. Okay lang po ba yun sa inyo?
Apo.
Need rin pong ipakita yung abdomen nyo para po mas lalong ma-assess yung abdomen nyo. Okay lang po ba?
Apo.
Before proceeding, I will collect the subjective data of my patient. So, do you experience any abdominal pain?
No.
Okay. Nasusuka po ba kayo or may nahihilo?
No.
So, na-observe niyo po ba na nadadagdagan or bumabawas pa yung timbang niyo?
No.
Okay po. I already wash my hands and provide privacy for my client. So, I position my client in a supine position and we were ready on assessing his abdomen. So, first I will be inspecting the skin color, vascularity, if there are any stretch marks and lesions on his abdomen. Okay, so I don't see any lesions. Your skin color is slightly paler kasi mas hindi siya exposed sa environment, kaya siya mas pale. Wala ring bukol, wala ring lesions. Okay? Then next I will be inspecting the umbilicus of my patient. Okay? As I can see, the surrounding of your umbilicum is normal. I will be inspecting the contour and the symmetry of his abdomen. As I observe, it is flat po and round. And ito naman po is pantay, which is normal po natin. Okay? Next I will be inspecting the abdominal movement and note for the respiratory movements, aortic pulsation, or peristaltic waves. Okay. Okay, so I observe the respiratory movements. So, I can see the slight pulsation of the abdominal aorta on my client and that is considered normal. So, normally yung peristaltic wave is nakikita lang sa thinner patient. Next I will be auscultating for the vowel sound of my patient to note for its intensity, pitch, and frequency. I will use the diaphragm of my stethoscope and will begin auscultating on the right lower quadrant of my patient. Then the right upper quadrant. Then the left upper quadrant. Then the left lower quadrant. Upon auscultating, I heard the gurgling of his abdomen, which is considered normal. Next I will be auscultating for the vascular sound and the friction rubs using the bell of my stethoscope, and also to note for the bruits or swishing sound. First is near the xiphoid process, which is located here. Then the right and left renal artery. Then the right and left iliac. Next I will be performing a light palpation 2 to 3 cm on my patient's abdomen to note for the tenderness or guarding in all quadrants, and also to note if there are any lumps. I will be using a gloves for clean purposes. So, sabihin niyo lang po if there any pain or tenderness kayong mararamdaman. Okay po?
Up.
So, let's proceed on the right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. Next is the deep palpation or the 5 to 6 cm dip on my patient abdomen to note if there are any tenderness, lumps, or the guarding in all quadrants. I will be palpating also with my glove hands to avoid contamination. First is the right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. So that's the end of assessing the abdomen po, and upon assessing your abdomen, wala akong nakitang lesion, sugat, or masses or bukol na nakapa upon palpation. And yung coloration of your abdomen and umbilicus is normal, which is paler siya kasi hindi siya mas exposed sa environment, kaya siya naging mas paler kaysa sa general skin tone mo. So that's the end of assessing the abdomen. The last thing that I will be doing is to document all the findings that I collect to my patient assessment of the abdomen. So this is the end of the video. Thank you for watching.